I looked way older, so happy to be non-bearded today and in front of you. My name is Darren Larson. I'm the Chief Medical Officer of OntarioMD, and it's my pleasure to present this next session in this stream, which I think is going to be really exciting for those of you who are looking into the world of what the power of EMRs can be and how some of the newer EMRs coming into the marketplace might meet your needs. We have InputHealth with us today, Dr. Puneet Seth, who's a family physician working in Toronto, and Marc Faktor, who's working with InputHealth in Vancouver. They're going to be giving us a joint presentation and demonstration about virtual care and the new horizon using the InputHealth product. Just a reminder, this is a non-accredited session as a commercially sponsored event, and commercially sponsored session is not subject to CME credits, but we do still want you to fill out the evaluation form at the end of the session if you can, giving us feedback on how the session went. And so on that note, I'm going to hand over to Dr. Seth and to Marc and let them take it from here.
Wonderful. So first of all, thank you, Dr. Larson, for the introduction. Thank you to everyone at OMD for this fantastic opportunity. Marc and I are absolutely thrilled to be here today. It's been a long time coming for us. And we're really excited to showcase what we know is going to be a unique and holistic solution for virtual care, and one that's offered directly from within a health record. Very excited to be performing a live demo shortly today. In terms of the agenda for today, we'll provide you guys with a little bit of a background as to who's InputHealth, what have we been doing, what is our philosophy and our approach to this idea of the collaborative health record. We'll also be talking a little bit about some of the work that we've been doing in the province to support COVID-19 response, both actually in Ontario as well as outside of Ontario. And then last but not least, we'll be going into a live demonstration and a Q&A. Perfect. So a little bit about us. So who's InputHealth? We're a Canadian digital health company founded 10 years ago by our co-founders, Dr. Damon Ramsey, our CEO, and Sean Jung, our CTO. And our origin story is that we actually started off as a consulting business that specialized in user experience and patient engagement through mobile apps. And we became actually really good at this idea of patient-reported outcome measurements. In fact, so good that one of our first clients was the Mayo Clinic, and we represented their solution for this for a number of years. However, we've been big dreamers. We wanted to make a big impact in the healthcare system, and both Damon and I are practicing physicians. And we realized that our impact was limited by the fact that we would have to interface with existing legacy software that practices ran off, namely traditional EMRs. And this eroded a huge opportunity for efficiency and transformation that we saw was possible through our software. Over the last 6 years, we spent this time building from scratch something that's truly incredible and that we'll be demonstrating to you guys today. And actually, perfect. Actually, we'll go back one slide here. Fantastic. Perfect. So point to note, actually, a little bit about our company as well, is that everything we've done to date has been as a bootstrapped, self-funded company that has not compromised its values for serving our clients and for protecting the integrity of personal health information. So that's been hugely important for us. We're also very excited to announce that we are one of the latest OntarioMD certified vendors, and as a true cloud-based solution requiring no VPN, no login to remote servers, as well as one of the only 2 vendors that allows for both push and pull of HRM. So super excited to be joining the OntarioMD certified vendor family. Perfect. So a little bit about the core of what we've been doing, which is reimagining what a health record could be if we could build it from scratch in the 21st century. There's a few key principles that we applied when we were building the system. First and foremost, automation. As practicing clinicians ourselves and knowing the pain points that our clients experience, we know that we want clinicians to be spending less time doing administrative tasks, less clicks, less interfacing on things that don't directly pertain to delivering patient care. So automation is a huge piece. Next is this idea of being virtual enabled, and being virtual enabled by design. So to us, that means 2 things. First of all, we want to know that as clinicians being mobile in the 21st century, that they're able to access our platform, as I mentioned, free of VPN, free of logging into remote servers, and being able to do so through a web browser. So that allows our clients to be mobile. In addition, we're virtual enabled because we allow patient care to be delivered regardless of the modality that it's taking place. So we know care takes place in person, but so much more of care needs to be taking place virtually. And to us, virtually doesn't just mean video. It means being able to track outcomes between visits. It means being able to provide patients with tasks. It means being able to measure quality of life even when the person's not in front of you, or being able to have a live chat. So this is built into the fabric of our platform. Last but not least, the platform needs to be data-centric by design. So obviously any business, any platform that's built in the 21st century already knows this, but we know that historically, EMRs have not necessarily been the greatest sources of high quality information. We've combated this by building a data-first principles company, and importantly, also by allowing patient data to be, or patient-generated data to be an active element of our system, and allowing patient-reported information to actually provide efficiency in how our platform runs. So at this point, I will hand over the mic to Marc.
Perfect. Thank you, Puneet, for so eloquently sharing our background and approach to reimagining the electronic medical record. And as Puneet noted, the collaborative health record is a true paradigm shift away from the EMR, as it connects patients and their care teams to each other through a shared cloud-based platform that powers automation and data-driven insights. In today's current EMR landscape, it's very common for there to be a series of solutions that provide awesome charting and billing solutions. However, when it comes time to be able to offer some of the more transformative elements to align with patient and system requirements, for example, improved access, outcome measurement, it's very common to rely on third parties and external vendors to be able to deliver these solutions and allow clinics to be able to move from point A to point B. This does mean that it's very common for someone to have to rely on 3 to 5 different roadmaps, support lines, privacy policies, as well as price points. This gets cumbersome, expensive, and it also inhibits an organization's ability to be able to move fast and adapt, whether that be to system transformation requirements like OHTs, and or whether it be to have to weather a pandemic. So in comparison, the CHR is once again a dramatic paradigm shift away from this multi-vendor approach, and it's a true end-to-end platform. And we're very proud to be able to offer all of these facets in one beautiful end-to-end experience with one price point, one collaborative innovation partnership, enabling clinicians to be able to feel liberated in being able to move quickly and adapt to the needs of the changing environment. With that being said, the last 20 to 30 years went from paper to EMR. This created a series of systems of record. We're looking at the next 20 to 30 years move from EMR to CHR-like solutions and to create systems of engagement. The solutions of record really haven't done us justice, and Atul Gawande said it really nicely in the New Yorker as to why doctors hate their computers. And it's because the systems that we've deployed really don't work for us. We need to really create systems of engagement, automation, virtualization, and data optimization to be able to help clinicians get home sooner to see their families and deliver the best possible care. So we look at a few core foundational elements for us to be able to see success in achieving the mission and of the collaborative health record. With that being said, the first one is a secure cloud-based platform with open architecture designed for interoperability to the system. Whether that's connecting bidirectionally to HRM, connecting to OLIS, or allowing enterprises to build on top of the collaborative health record through a state-of-the-art API, we feel that this is a core component to our value proposition. Furthermore, we're not just a plug-in to legacy software. We're not filling a little bit of white space and adding a little bit of value to a legacy vendor. We're providing a true transformative experience, and in the ability to truly replace an EHR and give a clinician and a team of clinicians an end-to-end experience to be able to meet the needs of the transformation happening is something that we do very well and we're very proud of. We also look at patients, as our friend Dave DeBronkart, an e-carcinoma patient, said very well, as the most underutilized resource in the healthcare system. And we use their their data in a very meaningful fashion to be able to contribute to the workflows of clinicians. So what we'll show you as an example is an opportunity to be able to have a patient go online, book an appointment, select a presenting issue, fill out a series of pre-visit questionnaires linked to structured patient data, fill out the history of presenting illness for that clinician, pre-select all the templates for that clinician to go about their day. And by the time they get into their encounter, maybe 60 to 70% of the work is already done for them. Furthermore, we're very passionate about making sure that virtualization and data-driven analytics are core components to a clinician's daily workflow and help drive organizations forward. Moving on, COVID hit us really hard and quickly. As a digital health company, we took it upon ourselves to realize that we have an opportunity to do some good. We have a tool set here that is designed to improve access, that is designed to be deployed in a rapid and scalable fashion. So our founding members and our team took it upon themselves to work 90-hour weeks and rapidly deploy the CHR across entire health regions, supporting intelligent intake, assessment, triage, and enhanced collaboration across entire enterprise sites and health regions. What we were able to notice was the CHR is innately designed for rapid and scalable deployment. It aligns very nicely to the system transformation underway, and we're very proud to have a solution that's able to support our users in being able to combat this pandemic and align themselves with the future of healthcare. Furthermore, when a series of clinics and enterprises, struggled to be able to deploy virtual care, to be able to meet the demands of the pandemic, we were very proud, and our clients were very happy and proud to be able to deploy virtual teams of care instantly overnight because they had the CHR in place. With that being said, I'm going to thank you guys for listening to us here, and a deck can only say so much, so we're going to take a little bit of a risk here and do a live demo, and I'm just going to prepare that for you. Perfect. So here I am, I'm acting as a patient. This will actually be an e-booking link that's coming directly from a clinician's website or an organization's website. They're going to have an opportunity to select a series of different locations, whether they're physical and or brick and mortar locations. In this instance, I'm going to go ahead and book a virtual visit. You can see here it's asking me to select the primary reason for my visit. These are totally customizable based on the needs of an organization, and they'll change from time to time. We have a series of metadata that can be hidden behind all the different primary reasons for visits. And in this instance, I'm stating that I'm feeling ill, and as a result, I'm going to have an opportunity to select a cold and flu and or a sore throat appointment here. We get to then link the presenting issues to a series of appointment types. And as a result, I have two options here. I can do a walk-in visit or I can do a virtual visit with my health team. Here I have an opportunity to choose a practitioner that is on shift and has availability in their calendar to be able to see these types of appointments. I'm going to go ahead and choose Dr. Seth here. And now this is going to bring up real-time calendar availability based on those clinicians' schedules and what they have to offer on those days. I'm going to go ahead and book a 12 p.m. appointment here and click next. It's going to remember me. However, certain pieces of information may change over time, like my phone number and email, and I'm going to have an opportunity to put those in. I can also see that my primary practitioner is Dr. Seth, and I will be able to go next. This is going to provide a nice summary of my appointment details, and I can understand that this is just a request. Now, this can be an auto-confirmed appointment depending on your settings upstream. However, in this instance, the OntarioMD health team wants to be able to triage that request to make sure it's appropriate. Another cardinal strength to the collaborative health record is the ability to automatically disseminate questionnaires for intake, assessment, and outcome measurement to a variety of different predetermined workflows. In this instance, I'm going to start the pre-visit questionnaires associated with my appointment type as well as my presenting issue. This is a true mobile responsive application as well. So you can start to see, I'll have an opportunity to be able to do this on my mobile phone as a patient, as well as on my desktop. Because COVID is actually a thing these days, and we're working very hard as teams of clinicians across the country to be able to combat it, we might want to be able to assess someone's COVID intake prior to seeing them as well. So I'll go ahead and book for myself. I'll be able to say I got a cough and shortness of breath. I'll say no. These are fully customizable. These are all structured units of information exchange. And our clinics have full autonomy in being able to deploy these. We also have an opportunity to leverage a series of standardized evidence-based questionnaires for intake assessment and outcome measurement. And a fun fact, we actually do 250,000 structured digital units of information exchange with patients per month. That gives it, we also have an 84% response rate in our patients being able to respond to these questionnaires. So if I wasn't a good patient and I didn't fill out this questionnaire upon intake, there would be reminders that could be sent to me, or I could have this actually put upon me in the waiting room for the virtual visit. Now, this is our standard cold and flu questionnaire, and I'm going to have an opportunity to go through. So I'll say it's a first visit, 1 to 2 times. No, I have not been in contact. I'm going to speed up here because I see that we're running a little bit late. There's also a series of branching logic that you can build into this. So you can see here, I'm looking at here. I'll say I have a little bit of a fever. I did measure with a thermometer. It was not 38 degrees, so I didn't lie on the first questionnaire. And I will be able to go through and say, yes, I've taken some meds. They were not antibiotics. They were fever reducers. They did work well. And there were some OCTs. Was it helpful? Yes, it was. So that's the basic patient experience here. You can see that everything's been completed, a nice summary of my appointment. My appointment's not confirmed yet. However, it will be confirmed in just a moment. I'm now going to pivot to the clinician view, and I'm going to let Puneet drive this discussion.
Wonderful. Thank you, Marc. So now we're looking at the CHR, or the collaborative health record, from the perspective of a clinician. Specifically right now, we're looking at the scheduling system of the platform. Obviously, we have limited time here, so we can't go into a lot of detail with things, but this is a highly dynamic and responsive scheduling system. Right now, we've just clicked on the requested appointments that have come in on the left-hand side. By clicking on them, it's opened a dialog box, and as you can see, it's specified that this is a virtual visit. Important point to note is that we support both virtual as well as physical visit appointment booking. As Marc was showing, we also have the ability to be able to see the completed questionnaires that the patient had done in advance of the visit. And by clicking confirm, we can confirm the appointment and then be able to send the patient a customized notification at their preferred method of communication, be it email, SMS, or both. The visit is now confirmed. The next step as a clinician that I'd be wanting to do is to initiate the encounter. This can be done simply and easily by clicking on the appointment and clicking on encounter. So again, when we talk about automation, there's a number of automated steps taking place. It's taking me from schedules to the patient chart. It's opened that specific patient's chart. It's loaded the appropriate corresponding encounter template associated with this visit. And it's now detected that the patient's responses can be pulled directly into the note. So this is an incredibly powerful and unique attribute of our platform, which is that patient-reported outcome measurement feeds seamlessly into the health record. So what you're seeing here are actually a clinical summary of the responses that Marc provided to the questionnaire that he was completing a moment ago. What this does is this dramatically reduces the amount of time being spent for documentation. You still have the ability to edit that note. You can type. You can do voice to text through a variety of different voice to text modalities, including drag and nuance and built-in dictation tools. And you're able to use our highly dynamic encounter templates to minimize the amount of typing that would need to take place. Important point to note is that our encounter templates actually allow you to structure multiple parts of the encounter. So the history, the assessment and plan, the diagnostic code can be pre-templated, the billing code can be pre-templated, and even post-visit follow-up questionnaires can be pre-templated so that you literally have very little clicking to do and things can be as seamless as possible.
And the beautiful part here is the patient actually selected that encounter.
Exactly, and that took place in this case through the actual e-booking pathway. So all of this is linked to what we call the presenting issue, which the patient is able to specify. Now, looking at the actually just to the left of the encounter, you'll see a dynamic section there that includes the medical history, the family history, and so forth. This is the patient summary. This is equivalent to the cumulative patient profile, or CPP, a single view where you can see all relevant parts of the patient's chart. Unlike a lot of other systems, there's a huge amount of customizability with respect to how you view this. Things can be moved around, and you can even embed analytics tools and calculators directly into this view. Obviously, we don't have too much time to go into too much detail with that, but instead, we'll look at something really exciting here, which is our pathways, which is essentially the way in which a patient is able to enter a care pathway and engage in a virtual encounter directly from within the health record system. What Marc is showing here now is actually kind of our command center, almost like a CTAS board, which shows the patients at different stages of care. So for example, we have a column with all of the patients that are pre-visit that are waiting to be seen. We have a column with the patients that are currently in a visit and those that have completed a visit. You can use this as a way of being able to navigate and see where your patients are, as well as directly engage into patient care with them. Very unique part of our system, and it actually incorporates something that's typically seen in project management, but now applied to patient care as a unique way to introduce efficiency. What I'll do now is I'll actually hand over to Marc, who will discuss the patient experience of the virtual encounter.
Perfect. Thank you so much, Puneet. And I'm just going to quickly pause sharing because I've just received an email and I need to be able to go into that email in a privacy and security compliant manner to be able to show you what that patient would experience. 1 second here. Just bear with me, guys. I'm just pulling out my email. Okay, perfect.
An important point to note here,
okay.
Sorry, I was just going to say, while Marc loads this up, important point to note here is that virtual care can actually take place through the platform, both through a dedicated mobile patient application, as well as a web app. We'll be demoing the web app today.
Perfect. So what you can see here is an opportunity for the patient to actually get an invitation to the virtual visit just prior to it. So if a patient books a virtual visit 3 weeks from now, our system automatically sends that unique virtual visit link with an access code 5 minutes prior to all appointments. So here on the left-hand side, I'm going to go through the patient experience to bring them into that virtual encounter with structure. On the right-hand side, I'm going to keep the clinician's view apparent. And I'm just going to resize a couple things so we can have a good experience here. So focusing on the left-hand panel, we're going to see here that I'm going to be introduced to the virtual visit. First and foremost, we're going to make sure that that patient's device is working appropriately. So does their webcam have permission? Does their microphone have permission? These are unique, small enhancements that we've been able to make to help clinicians deliver and optimize virtual care throughout the pandemic. You can see here that I'm going to allow access to my microphone and my camera. I'm going to have an opportunity to also see that I'm on the appropriate operating system to see success in that virtual care encounter. And we're also going to go through a custom virtual care agreement to make sure that that patient consent is provided. You can see here on the right-hand side, everything has been okay, and I've been entered into the waiting room. And then on the right-hand side, I've got 3 green check marks letting the clinician and or the administrative team know that this patient is ready for a virtual encounter. I'll keep going here, Puneet. So we can see here, we can move this patient to the visit. And from this point onwards, we can elegantly bring that patient into that encounter. We can see here there's a chat box and we have an opportunity to automate chat to that patient. And you can see here Dr. Seth has welcomed me to the future of healthcare. And we can also say that I'm going to offer him a few tasks to be able to complete prior to being seen. It's very common for chat to be the primary mechanism of an encounter, and we actually encourage this. Just like Kaiser Permanente has over 80% of virtual encounters happen through asynchronous and or synchronous texting, we have a tool set that allows you to do these things very quickly. We have a very unique structure where we can assign patient and or staff actions to make sure people move through those virtual workflows nice and appropriately. So if I want to have that patient watch a video as to what to experience and in engaging with our organization and or how to wash their hands or do anything specific to their condition, that's totally doable. We can have them complete COVID screening, other pre-visit questionnaires, upload pictures, receive payment if needed. Very robust opportunity to be able to structure that virtual visit encounter. We also have an opportunity to have these tasks be validated. So if a task is not done, then a patient cannot move from one phase to the other in the treatment journey. So this is quite a remarkable way to be able to think about a virtual visit encounter and make sure no one falls through the cracks. Finally, we're going to have an opportunity to actually start that video visit. And I'm just going to make sure that I'm going to mute my microphone so we don't get any crazy echo. And you can see here that I'm in a virtual visit with myself in this instance, but I'm going to now make the screen full size, and I'm going to pass it over to Puneet as to how he as a clinician would be able to deal with this encounter.
Gentlemen, we're actually at the end of our 30 minutes now, so at 11:29. So I want to thank you both for being really, really engaged with us today. And we've had a lot of people on this session, so I'm super excited about how well it's gone. And if you have any other questions, make sure you visit the virtual vendor showcase where InputHealth is present. And so you're happy to engage with the company at that point. But Puneet and Marc, thanks so much for spending time with us today, for showing us this product, and congratulations on your certification that happened last week. So we're excited to have you in the family. On that note, we're going to stop.
Thank you so much.
In 3 minutes, we'll be moving ahead with our next session, which will be with Akiro Health.